Are you thinking you're interested in getting facial plastic surgery in the future, but you're not sure when you can get certain kinds of aesthetic treatments? I'm here to help explain that for you so that way you know. My name is Dr. Lexi Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. And on today's episode of Face the Facts, we're going to talk about aesthetic treatments that are on the non-surgical side that you might want to avoid prior to surgery. This is a very common thing that has been all over social media recently and has come up in a lot of my consults. So I just wanted to kind of put it out there and note that this is based off of my personal preferences as a surgeon. You might find that your surgeon feels differently. If we are talking about collagen stimulating treatments, so this would be things like Sculptra and Dilute Radiesse, or energy-based devices like Ulthera, Cool Sculpting, things like that, I generally recommend that you wait at least a year, if not longer, between the time of when you last had your treatment done and when you plan to have surgery. And this is because it does cause some scarring and disruption of the tissues under the skin, and that can make surgery a lot more challenging for both the surgeon as well as for you in your recovery. If we are talking about things that can cause contour or position changes, so that might be filler, like, you add lip filler so your lips look bigger, or Botox, as in, you do a Botox brow lift so your brows look a little bit higher than before, I do recommend that you wait at least until most of that has settled out. So for Botox, Dysport types of things, I usually say wait 3 to 4 months at least, so that way it has completely worn off. If it's filler, as long as we have a good history of how much filler is in there, like you've had 10 syringes versus like 1 syringe and where exactly it was injected, you can maybe finagle that 6 months, 1 year afterward, or it's up to the surgeon really about how they feel in terms of operating in a known field where you have filler there. If it's talking about skin treatments on a more superficial level, so this is now lasers, peels, microneedling, things like that, things without energy, for example, usually it's actually okay as soon as like 1 month, sometimes even 2 weeks afterward, but again, it also depends on the strength of the peel, the strength of the treatment, and what exactly surgery-wise you're going to be getting. So I hope that was helpful for you in terms of timing of any kind of aesthetic treatments before surgery that you plan to have. After surgery, it's also a little bit dependent on what you're planning to get and what surgery you had. We might do another video on that in the future if people are interested, but I hope you learned something today. My name is Dr. Lexi Wang. That was today's episode of Face the Facts. We will see you guys next time.